Hello, friends. My name is Dr. Avril Watts. I am a clinician in NHS Scotland, and I'm also a scientist by training. Today, let's talk about monkeypox. Monkeypox, we have around 200, little less than 200 cases in more than 12 countries all around the world till the last reports came in. This virus is not a new virus. I must emphasize that. It's not something very new, although we are concerned about it, but it's not a new virus. It was first detected in 1958 in Democratic Republic of Congo. It was detected in research monkeys at the time. First human case was detected in 1970. And since then, there have been cases in Democratic Republic of Congo, countries like Nigeria, and other Central African and Western African countries. Cases outside Africa have been detected in US. There was a small outbreak back in 2003. And then there have been cases in UK, for example, in 2018, 2019, 2021. There have been small, very small outbreaks of 10 or maybe 15 cases at the most, and even less than that. And all these cases have been linked to travelers from either Nigeria or other Central African countries. So there hasn't been community transmission so far. But now we see community transmission in UK and perhaps in other countries too. So that is one of the concerns that are being raised. Monkeypox is actually a DNA virus, unlike COVID or coronavirus, which is an RNA virus. Monkeypox belongs to pox, group of viruses, and the other one which probably you have heard of is smallpox. The only virus which we have managed to eradicate, and that was back in the 80s. And because of that, since then, we have also stopped giving smallpox vaccination, and kids which are especially after 2000, in many countries, they're not getting smallpox vaccine. And hence, we are low on immunity against pox viruses. And it is known that smallpox vaccine can offer 80% protection or 85% protection against monkeypox if you have had it recently in last few years. How does monkeypox transmit? So the first of all, the commonest or the most common transmission route is from rodents or infected animals. In this case, largely rodents. We don't know which is that animal, which is the reservoir for this virus, but from them directly to humans is the commonest source of this virus coming into human beings. It can travel from human to human transmission, but it's largely through fomites, through bed sheets, through linen, which has been shared between the patient and the non-infected person. It can also get transmitted through respiratory route. If somebody coughs or sneezes on you and the person has had the virus, that can get transmitted. It can also get transmitted through the mucosal membranes, which are the linings in the eyes, the nose, and the mouth. So this virus can also enter our skin through the broken skin, even though we cannot see the broken part of the skin. Minor scratches that can lead to that can open a gateway for this virus. So that is how it gets transmitted. What happens when this virus gets in? What are the signs and symptoms? First of all, the incubation period. So from the start of getting the virus in the system until the disease lasts or you start seeing the symptoms. So the incubation period is anywhere between 5 to 21 days. Once the virus is in, fever can set in, first of all, after a few days' time. So the other symptoms along with fever can be headache, malaise, tiredness, muscle ache. And one of the specific one is lymphadenopathy. Those small glands in your neck, different parts of your neck, in the axilla or the armpit, in the groin area, those lymph nodes can get swollen for a few days. And that also is a peculiar feature for this virus as opposed to smallpox. In smallpox, you wouldn't see this lymphadenopathy. So after a few days of this lymphadenopathy, a specific, very, very typical rash can appear on your skin. This rash often and most commonly starts from the face, and then it can spread to the other parts of the body. It can also affect your palms, which is quite unusual for rashes to appear. That surface is quite unusual. The size of these rashes could be varied. It can be very, very small, and it can be quite big ones in different parts of the body. It goes through different stages, so it can be flat, and then it gets a bit raised, and it can be filled with a clear fluid, and then that can be followed with a straw-colored or a bit of cloudy fluid, or even pus at times. There can be a slight ring of redness around these rashes on the skin. Once these rashes then they burst open, and they form a small V ulcer, and then that ulcer scabs over, and then the rashes heal. And this whole process can take up to 2 to 3 weeks from the start of the rash. Till the person has the scabbed rashes, so till all the rashes have healed and scabbed over, till that time, person is infected. That means he or she can pass on the virus to other human beings. So that gives us a time span of a few weeks that a person can transmit the disease to the other person. As I said, one has to be in close contact with the patients to get this disease, so the transmissibility of this virus is not as high, or it's actually quite low if we compare it with SARS-CoV-2. However, the mortality rate, it can kill people. The mortality rate is quite high. This can kill up to 10% of its patients. So there are two strains. One strain can cause deaths in 10% of its patients, and the other strain can cause deaths nearly around 1%. To remind us, COVID or coronavirus, SARS-CoV-2, can have mortality rate which is generally less than 1%, depending on the age group we are talking about, but globally that's what we are looking at. About the treatment aspect, if somebody gets this virus, so obviously seek medical help as soon as you realize that this could be monkeypox, and get it checked, or at least clinically examined. It is a clinical diagnosis, just like chickenpox, and there are some tests done to confirm things, but those are done later on, so one can be a suspected case of it. And that's why you'll hear in news there are 90 detected cases and 90 maybe suspected cases, because those are clinically diagnosed. After the clinical diagnosis, the treatment aspect involves supportive treatment largely, and studies from Africa has shown us that depending on the access to supportive treatment, the mortality depends on that. So supportive treatment is giving fluids, giving antipyrexicals against fever, treatment against fever, and other symptomatic management. There is no fixed antiviral treatment which has been tried and tested and which works against monkeypox. However, the vaccine of smallpox does offer 80 to 85% protection against monkeypox too. But as I said, we have already eradicated smallpox, and as a result, smallpox vaccination is not a regular part of national vaccination programs, and hence we don't have people inoculated with smallpox vaccine. Hence, we don't have immunity against monkeypox in vast majority of population in many countries. And even those people who have had smallpox 10, 20, 30, 40 years ago, their immunity is way low now, that we cannot really depend on it, that it will protect them against monkeypox either. However, it can protect against the severity of the disease. So currently, preventative measures do include vaccination, smallpox vaccination being offered and given to some of the healthcare workers who are more prone to get it because they are dealing with the monkeypox patients. That can give them a lot of protection. Masks can help because, as I said, that one of the routes of transmission is respiratory system through how we breathe. So masks are very helpful again. Hand hygiene is a very good thing in these cases, especially those people who are taking care of the patients, who are in their vicinity, in the ring around the patient. From ring, I remember another thing is that smallpox vaccination can be given to those people who are around the known patients, so that we can have a ring fencing of the around the virus, so that the virus doesn't transmit beyond that. Just a word of caution that although it doesn't transmit quickly, although we know this virus from a long time, but because this virus is spreading far and wide now, and there are so many cases, which is very unheard of about this virus, that is what it raises concerns, and we are still not out of the coronavirus pandemic yet. So we don't know how this virus might be behaving, if there are any changes in it, if there are new variants of it. So that is the reason of concern why we should be cautious about it. I hope this information has answered some of the questions in your mind or given you some new information regarding monkeypox, which is causing anxiety in many groups. And we should be concerned about it, and we should keep an eye on the developments. If there are any further questions, suggestions, comments, please feel free to leave them in the comment section or ask me on my socials. I'll definitely get back to you. Take care.